Calcinosis in juvenile dermatomyositis. Definition: Juvenile dermatomyositis (JDM) is considered a multisystemic disease of uncertain etiology. The clinical manifestation is an unsupportive inflammation of the striate muscle, gastrointestinal tract, and skin, with the presence of vasculitis, and it occurs with muscular weakness, rash, and the late apparition of calcinosis. Dystrophic calcifications are present in 30 and 70% of children with JDM.
So dermatomyositis is part of a heterogeneous collection of rare diseases called idiopathic inflammatory myopathies or autoimmune myopathies. But in few words, dermatomyositis is a disease that affects the skin and the muscle. It can affect the skin and cause a characteristic skin rash, which means that when we see it, we know that this is dermatomyositis. It's usually in sun-exposed areas, like it can cause a V-shaped rash of the upper chest, a shawl-like sign over the upper back, over the knuckles or the elbows. It reminds us of someone being out in the sun and having a suntan. But in reality, this is just the skin rash of dermatomyositis. And it can also affect the face, and especially the eyelids. That comes from a dilatation of the vessels in the area. People can also have an erythematous rash of the face that is called malar rash, and this is something that we can see in lupus as well. But the difference between the two diseases is that in dermatomyositis it can affect the whole face, whereas in lupus it spares the nasolabial folds. So the rash is limited to this area, but in dermatomyositis can affect the whole face. While skin rash is characteristic for dermatomyositis, and that's why it's called dermatomyositis from derm, it can also have symptoms similar to polymyositis like muscle weakness. People can develop proximal muscle weakness, which means the shoulders, biceps, triceps, and the thighs. They feel weak. They suddenly see that they cannot climb up the stairs, they have difficulty, or they have to use their arms in order to get up from a chair or their bed. When they try to comb their hair, they cannot keep their arms high enough to complete the task. Lastly, another organ that it can be very important and can be affected in dermatomyositis is the lungs, where the patients can develop what is called interstitial lung disease. That means that the lungs are inflamed and can lead to fibrosis. That has a consequence that the lung is not able to absorb the oxygen from the air.
Applications in medicine. It's important to know about the diagnosis of JDM that is established in base of the Vaughan criteria in presence of a typical cutaneous eruption and the three next criteria: proximal muscle weakness, increase in muscle enzymes, and inflammatory myositis in muscle biopsy.
My name is Hunter Hartsock. I'm 17. I've been diagnosed with juvenile dermatomyositis. It is an autoimmune disorder, which means it has to do with your immune system. In particular, my white blood cells attack things besides bacteria in my internal system, like, for example, my muscles, and that makes me really weak. And yeah, if it wasn't treated properly, I could have lost all strength in my muscles and not been able to walk or anything like that. The rash on my hands, that's the rash that I got from my illness. It's due to inflammation of the muscles, and the inflammation has come up and it has reached the surface of my skin, so that's why it's so red and kind of swollen looking-ish. When new rash forms, it's usually like scaly and dry, and it can usually only be taken care of with a steroid topical. I've overcome my illness by going through constant physical therapy to help me keep up my physical strength. I've also gone to Iowa City about every month for, I think, about 8 years now. I get lengthy infusions there. It helps recreate or stabilize my immune system so my white blood cells don't go overactive anymore. The treatment usually lasts about 6 hours. It used to be longer, but since I'm getting better and I'm starting to weigh more, they can pump my medicine into me at a faster rate. So I'm not sure when I will be able to get off those treatments, but so far we're doing really good. I'd say we're about in remission, or we are in remission. My last blood test was perfect, and that's good. I've never had one of those before, so it's looking bright, slow progress, but we're not going downhill, so that's the most important thing. In the future, I am planning to go to school to be a paramedic / EMT. That really interests me since doctors and medical personnel have helped me get through the tough times in my life, so I'd like to do the same for other people.
Pros and cons. Pros: the correct diagnosis betters the patient's lifestyle. Cons: the wrong diagnosis can confuse it with another disease. Sometimes the treatment causes adverse effects.
Dermatomyositis is a muscle disease characterized by inflammation and a skin rash. It is a type of inflammatory myopathy. The cause of dermatomyositis is unknown. Experts think it may be due to a viral infection of the muscles or a problem with the body's immune system. It can also sometimes occur in patients who have cancer of the abdomen, lung or other body area. Dermatomyositis symptoms: difficulty swallowing, muscle weakness, stiffness or soreness, purple-violet colored upper eyelids, purple-red skin rash, shortness of breath. Dermatomyositis treatment: the disease is treated with anti-inflammatory medicines, called corticosteroids, and drugs that suppress the immune system. When your muscle strength gets better, your doctor may tell you to slowly cut back on your doses. However, most people with this condition must take a medicine called prednisone indefinitely. If the condition is associated with a tumor, the muscle weakness and rash may improve when the tumor is removed. Dermatomyositis is a common disease, yet every individual needs unique treatment and care. we encourage people with dermatomyositis and their families to learn as much as possible about the latest medical treatment and approaches, as well as healthy lifestyle choices. For more information about dermatomyositis and how to treat dermatomyositis, just click on the link at description or visit www.mainmd.com. Thank you.
Issue applying in Ecuador. In Ecuador, it's important to know about the calcinosis in juvenile dermatomyositis, how to diagnose it, and the right treatment for this disease. Conclusion. The treatment with infliximab, thalidomide, and aluminum hydroxide showed 2 months after treatment the patients have improved muscle strength and fading of the rash, and 9 months later the radiograph showed that the calcinosis has had decreased.
Juvenile myositis is actually a group of rare autoimmune diseases. It covers juvenile dermatomyositis, juvenile polymyositis, and amyopathic juvenile dermatomyositis, which affects approximately 17,000 children in the United States, or 1 to 3 out of every million children. It has muscle weakness, fevers, flu-like symptoms, muscle pain. It can affect the heart and lungs as well as having complication of vasculitic ulcers and calcinosis. Early diagnosis is very important, and so being able to know the symptoms and being able to diagnose it accurately is very important, both with pediatricians and the rheumatologist or dermatologist. Juvenile dermatomyositis has a very distinctive facial rash, very similar to lupus, as well as little warts on the fingers, which are called Gottfried's papules, as well as the bleakness that goes along with it. As well as the best ways to, along with the early diagnosis, getting accurate and necessary treatment as well. It gives the child the best chances in life and to achieve remission.